Usually I go walk onto the lab floor and look for a case of the week, but this week I was walking down the hall minding my own business when one of the technical service advisors from the all ceramic department grabbed me and said, "You have to talk about this on Chairside Live today." And she seemed angry. And I said, "What's the matter?" And she said, "We have to put a stop to this." I said, "What is it?" And she said, "Dentists using double arch trays for bridges." And I said, "Oh yeah, that's kind of a no-no, definitely." And she said, "You know, there's times where these cases are bad, and then there's times where they are worse." And so we're going to start, just for example, on this one. This one caught my eye too because of the three different colors of impression material. You know, we've got the blue, the purple, and then we have this brownish one here. You can see it over here. It's definitely you know, some sort of polyvinyl material that was added really just to the bicuspid and not to the molar. And then when you see the solid model, you can see why. You know, the margins here are pretty much, well, not quite equigingival on the distal, but on the rest of that tooth. But then on the bicuspid, they are way down there. In fact, I think I see foramen ovale down there with the trigeminal nerve coming out of it, or some state board question like that. But considering how deep that is, you can kind of almost see a fair part of the margin there. But anyway, that looks like why probably this impression was relined one last time to try to get down there. I'm guessing if we pulled that out, we would see that it didn't quite get all the way down there on that impression. But be that as it may, here's what that looks like when it's poured up and mounted. And so not that many teeth to use for lateral excursions here. But as the technical service advisor pointed out to me, this one's actually okay. You know, I mean, it's at least not going to have to be sent back to the doctor because even though we're kind of close on the reduction over here for this BruxZir bridge. But she said, look at the wear facets. At least we know when we close this down into place based on those wear facets, you know, that the bite is pretty much in the right place. And so even though they hate doing this and they don't like having to do excursions and feel like they're doing a lot of guessing, she said at least with natural teeth here with wear facets, it makes it a little easier on us, contrasted to a case that we'll see next when we look at that one. The interesting thing about this BruxZir bridge is that the dentist actually prescribed BruxZir anterior for this bridge. That's the new, more aesthetic version of BruxZir. And the reason it's called BruxZir anterior is because it's not as strong as the regular BruxZir, but it's more aesthetic, and so it's meant to go in the anterior. There was talk about whether or not we should name it BruxZir aesthetic, but we realized that a lot of people would probably want to use it in the posterior and say, oh, let me use the more aesthetic BruxZir because it didn't seem clear enough. So we named it BruxZir anterior to make it clear that it goes in the anterior. And then we have a doctor requesting BruxZir anterior from a second bite to a second molar on the lower. And it's tough to say. I don't have the scan sitting in front of me. I just grabbed it before they scanned it in. But it's tough to say whether or not there's enough room here. The minimum reduction, as you've heard me say a bunch of times for regular BruxZir, 0.6 of a millimeter, but it's 0.8 for BruxZir anterior because it's not as strong. And the reason it's not as strong is we had to alter the physical properties to make it more translucent. The good news about that is that it is easier to cut off, and it's still, it's right around half the strength of regular BruxZir, which still puts it about 50% above Emax, for example. So 650 megapascals of flexural strength versus, say, 400 for Emax and, say, 1150 for regular BruxZir. So we're still getting doctors requesting a lot of BruxZir anterior in the posterior. So apparently that name wasn't quite enough to indicate it. Now for single units, it's fine back here, most likely, because anything above 400 megapascals can be cemented as a crown. For a bridge like this, that's probably a stretch. Time to use the regular BruxZir, and I don't know, it's not like the regular BruxZir is that awful looking these days. I mean, do we really want to sacrifice, you know, that additional strength, almost twice as much, back here in the posterior on a bridge just for slightly better aesthetics? You know, we would never consider doing an Emax bridge back here. Of course, it's not indicated for that, but we don't need that much in terms of aesthetics on a bridge like this. So we're still trying to kind of get that message out about the anterior material, that yes, we can use it in the posterior for single units and maybe other places, but It's really kind of intended for the critical aesthetic areas on anterior teeth and bicuspids. Here's another one where instead of using a double arch tray like we saw in the first one, and of course one of the benefits is if the patient bites correctly into this, and I love this tray, that's the Quad Tray Extreme from Clinician's Choice. If they bite correctly into this, it's a pretty darn good bite. It's not great because we don't have enough adjacent teeth for something like a bridge. And some people, I've even heard Gordon say you shouldn't use a double arch tray if you're prepping the last tooth in the arch. So even if you're just doing the second molar, there's talk that you shouldn't use a double arch tray like this because you've prepped the last tooth in the arch and seating of the condyle, that you should go with full arch impressions, or certainly something bigger than a double arch tray where the patient's coming and biting together at the same time. But otherwise, that's a very accurate way to do it. And now we have a doctor who is taking separate impressions and also enclosing a bite registration along with that. But we're not even getting the benefit of the double arch tray here, but we're still using very short impressions instead of full arch for this particular bridge. And so at least when the violation is made with the double arch tray, we get a little bit of a better bite perhaps than when we do them separately like this. But if you're just going to take separate ones like this, boy, it's so nice and makes our job easier and ultimately your job easier when cementing the bridge if you just used a full arch tray, even plastic stock trays like this, to give us that full arch. And those are actually both of the prep arch, but the opposings essentially the same size. And let's look at this model when it was poured up. And you can see how difficult this is going to be for the technicians because of how these teeth are coming together. These are crowns. These are all crowns on the top, so we don't have the benefit of the wear facets like we do on natural teeth. Yes, we have a bite registration, but we're still, guessing just a little bit here as we put this and do our excursions. So both of these really, neither of these are something that technicians like working on. Both of these should have had full arch impressions and a separate bite registration, just so we have all the other teeth on the other side to make sure that all those unprepped teeth, to make sure that we have our bite correct, and when we go through our excursions, it's going to be correct. But both of these kind of suffer for that same fate, just not enough other unprepped teeth in the arch for us to use to really be able to dial in those excursions. But again, on this one, at least if the patient's closed together and there's natural teeth with wear facets, we feel a little bit better about getting centric correct. It's still anyone's guess whether or not we're going to be able to nail the excursions. But both of these really should not be done with double arch trays. And so that's what the technical advisor wanted me to pass on today. Just kind of a reminder that when doing any kind of bridge, and that's the same thing that Gordon's always said, that you can use a double arch tray for a single unit crown or two adjacent single unit crowns, but when you get to a 3-unit bridge or bigger, you're giving yourself the best chance of having a bridge that drops into place and doesn't need any adjustments with a full upper, full lower impression, and a separate bite registry.